Hey, just an opinion here, with a video that has nothing to do with my normal channel content. In fact, it's really not so much about an opinion as about advice and information. But I hope you'll take a minute to watch this video. I'm going to try and keep it short, and I hope you'll share this information with people that you think should know it. So, I recently found myself a guest at my local hospital due to a heart attack. And it really took me by surprise because I didn't consider myself to be in the high-risk category for a heart attack. I'm no saint, but, I eat pretty well. I quit smoking a while back, and I get a decent amount of exercise, and so on. So, I really didn't consider myself to be terribly high risk. So the reason for this video is to share with you, and with as many people as I can, the information about the symptoms that I had, because they weren't typical and I didn't even understand what they were. I was very lucky to go seek medical attention when I did, and other people that I know of specifically have not been that lucky. So my particular heart attack was caused by 100% blockage of the left anterior descending artery, or the LAD as they call it. And it is, to my understanding, and this is very layman's terms here, my understanding is that this is one of the arteries that feeds the main blood to the heart itself, the heart muscle, so that it can do what it needs to do. Well, when it's completely blocked, the heart's not getting the blood that it needs, so it's going to have a really hard time functioning. So according to the doctors and all the staff, they said I was very lucky to get help when I did. A lot of people don't survive this particular heart attack. In fact, its nickname is the Widowmaker. So if that has your attention, and I hope it does, listen up and let me tell you the symptoms I had. It started with me with some minor exertion, and I'm talking treadmill walking type activity. I felt a pain and a pressure in my back, between my shoulder blades, which is an odd place, right? You don't think about heart, or I didn't think about heart. I thought, maybe I've moved my back wrong or something, and I've got a disc that's complaining. But it was quite uncomfortable and downright painful. So it made me stop what I was doing and wait for it to subside, and it eventually did. And then in, successive events, anytime I would do any kind of walking or exertion of even a light nature, I would get this pain. It was right between the shoulder blades, in the middle of the upper back. And it felt, the way I described it to the medical staff is it felt like somebody had their elbow pressed between my shoulder blades and just kept pushing with even pressure down. It sort of burned, and it was a very focused pain, but I wouldn't describe it as a sharp pain. I also knew, just inherently, I knew it wasn't muscle. So I was thinking, maybe I've done something to a vertebrae or something like that, and and I took that seriously enough. But again, I didn't consider it life-threatening. I figured, boy, if this doesn't go away, I'm going to have it looked at. That's kind of where I was with it. So finally, it got so bad, the pain got so bad that I couldn't really tolerate it anymore. It literally took my breath away. Trying to describe to my wife what it felt like was difficult just because I couldn't talk, because it hurt so bad. And that's when we decided, obviously, that we need to go have some medical professional look at me and find out what's wrong. And again, I still really had no clue what the problem was. So I got to the hospital, I described my symptoms. Luckily, the trained professionals there understood what those symptoms could be, and they brought me right in. I got all hooked up to stuff, and boom, for several days I was their guest under treatment, and I certainly was having a very serious issue. The stereotypical symptom of a heart attack with, ooh, I have chest pain and my left arm is numb, only happens, so I'm told by professionals, about 25% of the time. So that means that 3/4 of the time, your symptoms are going to be something other than that. And some people even have no symptoms at all. And that's probably as bad as it gets, because as much as I hated the pain, I'm sure glad it hurt as bad as it did, because that's what got me to the hospital. So for folks who don't have any symptoms at all, or have lesser amount of pain, the less likely they are to seek the proper medical attention. So I said all that basically just to get the information out there that, look, A heart attack is not always going to be a traditional symptom event. And if you or someone you know ever experiences the type of pain that I had, mostly focused between the shoulder blades, or consider the low neck, upper back, that area, sort of a burning and intense pressure type of pain. Could be also some shortness of breath. You can get to the point where when it hurts bad enough, the pain itself will make it hard for you to breathe normally. And if you have that, then it could be something else. It could be nothing at all, but it could also be a very serious condition. So get help. Call 911. Get to the hospital however you can. Do whatever you have to do. Better to be embarrassed that it was nothing than to find out that it was something. Okay, so that's it. I hope I kept it short enough. I tried to. I just wanted to get this important information out. It was important to me to do it. I hope a lot of people watch this video. I hope it goes beyond the scope of my channel content, because it has nothing to do with that. You may or may not like my channel, and that doesn't matter. Just pass this information along however you see fit to friends, family, loved ones. So thanks for watching. Thanks for your time. And file this information away and use it.